Good morning, doctors. This is Dr. Victor bringing you interesting highlights from ESC Heart Failure 2021 Congress. Till Copernicus trial, ejection fractions were used to define outcome of a trial, but now this clinical parameter is used to group individuals with heart failure that will yield different outcome to a given treatment. In 2016, ESC heart failure guidelines classified and defined heart failure with reduced ejection fraction, heart failure with preserved ejection fraction, and heart failure with mid-range ejection fraction. Studies like CHARM, PRESERVE, and TOPCAT were disappointment as it showed results with ARNI and RAAS inhibitor close to placebo in patients with heart failure with preserved ejection fraction. Only PRAGON-HF trial with Sacubitril Valsartan showed positive response. In post-hoc analysis of CHARM study, Candesartan treatment showed effectiveness in heart failure with reserved and mid-range ejection fraction and not in preserved ejection fraction. If we consider retrospective studies with beta blockers in senior trial among all type of heart failure patients, individuals with mid-range ejection fraction were also fairly represented, and the outcome showed less mortality and CV hospitalization in patients with ventricular ejection fraction of more than 35%. When further analysis were made with left ventricular ejection fraction in quintiles, it was revealed that those with more than 40 to 60% range had significant mortality and hospitality benefit compared to other quintiles. A meta-analysis of beta blockers in heart failure showed significant survival from all-cause mortality and CV mortality in patients with left ventricular ejection fraction of 40 to 49% with sinus rhythm. Thus, it was concluded that post ESC heart failure guidelines, we have more knowledge of outcomes of heart failure with mid-range ejection fraction, more retrospective evidences, and the best evidences of outcome was with beta blockers and with Sacubitril Valsartan from studies with particularly data on mid-range heart failure. Thus, we can treat mid-range heart failures very effectively. Thank you.